This is Nancy Weeding and her husband David. They were retired and living an active lifestyle in Fredericksburg, Texas, but there would come a time in which intense pain would rule her life.
Pain doctors, pain management, did a whole bunch of stuff that we sort of tried to work through what we were given, and I went through physical therapy for 4 or 5 months too, and they were just trying to get me to walk straight.
We didn't know exactly what the pain was caused by, and we kept looking for the sources of it.
Nancy's internist referred her to an orthopedic surgeon affiliated with the Restore program at Hill Country Memorial. Her new orthopedic specialist identified her hip as the problem.
So he came in and he looked at the current MRI and he told me it was very degenerated. You go home and think about this. We said, no, make an appointment now.
David, a retired professor, researched to confirm they had chosen the best place to have the surgery, and he learned of the hospital's top awards.
One of my former students, who's a medical doctor in Georgia, head of one of the departments there, convinced me in talking to him that that award is so important because of all of the aspects of the hospital, not just the quality of the medical care in terms of surgery and nursing care, but the low incidence of infection and other things that affect the outcome of the surgery, not just the surgery itself.
The best practices of care across the country have been implemented here, and that includes how we prevent infections, the things we teach at pre-op class, the type of anesthesia that we do, the pain management protocols that we have. Patients are up, out of bed, day of surgery. They know, they have been taught this in class, so they're anticipating that and they're prepared for it and they're ready to do it when they get here because they know that's going to improve their outcome. After
2 years of suffering, Nancy reached a turning point. A nurse came in and asked her to stand.
And I stood up and there was no pain. And I just started walking.
At the end of the week, Nancy was released to go home where her physical therapy continued.
The therapist came that very first day. And she is the one that made sure I knew how to do these things, just to get around. And then they came, we went walking around the block and that sort of thing. So they make sure you're ready to go out into the world.
She was soon directed to Hill Country Memorial's outpatient rehab center, where she received ongoing physical therapy, which included a variety of exercises, and her therapist soon said she was ready to move forward on her own.
There's nothing I don't do that I normally do. You will get back to your normal self.